Hi, I'm Dr. Ianthe Cartwright, pediatrician at Princess Margaret Hospital and also at Pediatric Associates on Collins Avenue. This year we are celebrating World Sickle Cell Day today, Saturday, June 19th, 2021. This day is designed to help build awareness of sickle cell anemia for persons all over the world. So, what is sickle cell anemia, you might ask? It is an inherited red blood cell disorder where there aren't enough healthy red blood cells in a person's body to carry oxygen throughout the body. These red blood cells have a different shape, the sickle shape or crescent moon shape. As a result, this shape doesn't allow for the red blood cells to be as flexible as they normally are, and so they experience difficulty moving throughout the blood vessels. This can lead to decreased blood flow and blockage with decreased oxygen delivery to the various parts of the body. As you can imagine, a person with sickle cell anemia who is experiencing this can become very sick when those events occur. Before I talk more about the complications though associated with sickle cell anemia, let me explain how a person gets sickle cell anemia. You are typically born with this condition by inheriting a copy of the sickle cell gene from both parents. That means that a parent may not even know that they have the sickle cell trait and that they carry the gene until a child is born with sickle cell anemia. Most times in other countries, there's a newborn screen that can be done at birth that can let a parent know early or at birth if their child has sickle cell. However, most times in our environment, symptoms usually present by the time the child is around 4 months old, and that's when a parent or patient is usually diagnosed with sickle cell anemia. So, how do you manage if your child or relative has sickle cell anemia? One, the first thing I would advise, see your doctor regularly. Two, take all of the medications that doctor may prescribe. Take them every day as directed. Three, get vaccinated. There are special vaccines that every person who has sickle cell anemia should get and have to make sure that they are current with. And four, stay hydrated. We live in the Bahamas. We have a hot climate. We love our summers, but we have to maintain the regular hydration. Discuss with your doctor all of the possible complications of sickle cell anemia. Remember, awareness is key to better outcomes and survival during these difficult times or complications. Some of that can be pain in the arms and the legs as a result of the blockage of blood flow in the blood vessels, pain in the chest, the belly or the abdomen, swelling of the hands or feet, and that's typically how our younger babies will present at around 4 months old. Infections anywhere in the body, but most often and biggest complication is a lung or chest infection. Changes in how your child grows and how they mature. You may notice that a child with sickle cell anemia will have changes or different types of puberty experiences than a regular adolescent. Changes in their vision, and most often a big complication is their risk of stroke. So, treatment is aimed at avoiding pain episodes, relieving symptoms, and preventing all of these complications. Take your antibiotics if they are directed and prescribed. Most times in our environment, most children are on antibiotics as we call prophylaxis, or just to prevent any infections up until the age of 5. Other than that, you also have folic acid supplements in addition to your regular and proper diet that you may have to take to build proper healthy red blood cell production from the bone marrow. And there are some other special medications that you can discuss with your physician that you see regularly to decide if that is a medication that you should be on if you have sickle cell anemia. As I've said already, maintain a healthy diet, fruits, vegetables, drinking lots of water, having a balanced meal every day. Avoid extremes of temperature. As much as we live in a hot environment, it's also not good to go in extreme cold. That too can affect the way the blood flows and the way those red blood cells flow through your blood vessels. Exercise regularly and don't smoke. Smoking changes the caliber of your blood vessels. It also changes the caliber of your red blood cells. So none of us should be smoking. Finally, my best advice that I can give is if you do have sickle cell anemia, or if you have a friend or relative that has sickle cell anemia, we do have a local sickle cell support group do engage in them. It's always good to get support, advice from persons who are experiencing similar things to you.